like this.
Thanks. It's called a placebo.
I know. I'm aware. Hello and welcome to DocTalk, where we talk about the things we know you want to talk about to a doc. And this is a doc. Dr. Janet Choi is joining me. I'm Lissa Klein. We are here to do like the women's health version of Spotify Wrapped.
Yes, 2024 with a bow.
So what have we been talking about? What have people been talking about? What's been in the news? We are starting really this year to talk a lot about menopause care.
Yeah, it's about time.
Yes, it's hot, as they say. So I'm going to rattle off some stats. Before we started, Dr. Choi said that I was in charge of stats today, which is exciting.
You are.
And so 2024 saw significant strides in addressing menopause-related stigma, as I just mentioned, improving care standards. According to Bonafide's 2024 State of Menopause Report, social discussions and self-advocacy around menopause have increased significantly. 12% more women discussed menopause with friends and family. We were just discussing it before we started talking today. 14% more women brought up menopause in conversations with their doctor, which is a stat I love.
That's great.
Sort of starting that conversation with their physician.
And also like more self-awareness and self-advocacy, which is super important. Right?
Yeah. Despite this progress, challenges remain. So 99% of women surveyed called for an increased funding for women's health research, yet less than 2% of the NIH's 2024 budget was dedicated to this area. Fun fact, in 1993, women were added to medical research. Before that, women's bodies weren't studied. And that, I think, has contributed to a lot of this sort of lack of funding, lack of awareness, lack of discussion around things like menopause. Any thoughts there around
But I think some of the positives, though, is like that the Biden signing the White House Women's Health Research Initiative. I forgot the official title earlier this year, devoting a real commitment from the top down to really studying women's health issues and medical conditions that might affect women only or women differently from men. To ensure that women are getting the optimal health care that they need. Yeah.
And we talk a lot about how this affects women. Clearly, it affects their families, as them as caregivers and other spaces, but women are also in the workplace, right? Increasingly. I think the majority of college graduates are women, which is great, which means that trend will continue. And in this study, over 50% of women advocated for workplace accommodations for menopause, reflecting its impact on their professional lives, which I think is really important. I think accommodations are great, but good treatment, access to good care can also help minimize the need for accommodations.
Yeah, there are like multiple facets to this, as there are to everything. I was excited to hear that there are certain countries, not the U.S. yet, that actually passed laws to make sure there are workplace accommodations for women going through menopause. Menopause.org, the North American Menopause Society's new website, actually offers resources for you in case you wanted to approach your employer about trying to implement accommodations and also improve access to quality care for menopause needs for yourself and your colleagues.
Yeah. Talking to a doctor and getting treatment for whatever symptoms you're suffering with can help your life, but especially, I think, your professional life.
Yeah.
One of the things you mentioned is access to care, which we at Progyny are really passionate about, really one of our core competencies, I think. Can you talk a little bit about, it's good that women are asking their doctors about menopause, and women typically see OBGYNs as their primary care in many cases. What is the state of OBGYN training on menopause, and how does that look?
So after medical school, there's a 4-year residency training program for OBGYNs, 3-year training program for internal medicine. So there are other primary care doctors whom women might turn to for menopause support, and they're fantastic physicians across the country. However, the majority of residency programs, I think, like last year, there was a survey of all the OBGYN residency directors in the country, and only about 23% said they offered any kind of menopause training in their 4-year training program for OBGYN residents. And so there might be a lot of well-intentioned and otherwise very well-trained OBGYNs who may not be as knowledgeable or even comfortable taking care of menopause-related needs. And that's why it's so important, as we're realizing, to be able to connect with a menopause expert who is up on the most up-to-date peer-reviewed literature and guidelines, so you can have your symptoms addressed straight away.
Yeah, I was sharing before we started recording that I have been suffering with some perimenopause symptoms for the last, 6 months-ish, something like that, 9 months, and talked to my good friend Dr. Choi.
No charge.
And she helped connect me through the Progyny benefit to a really wonderful physician who's really been helping and making a difference.
Yeah, she's fantastic.
Yeah, and we're going to talk to her later. That was
Yay.
a little preview for you guys. On the subject of access to care, another study that I really liked reading was by Deloitte in 2024 as well. On average, women required almost 10% more healthcare services than men, even when you exclude maternity-related expenses.
That's pretty surprising and shocking.
Yeah, I think so too. And yet, 34% of women delayed or skipped those crucial well women visits, like screenings, I'm assuming like menopause, mammograms, mental health, obstetrics, gynecology.
Like even basic things like pap smears and STI screening.
Yeah.
Really important because you want to try to hopefully not have to deal with an acute problem, an infection, heart disease, heart attack, stroke. And if you kind of keep up with your scheduled preventative healthcare visits early on in life, that actually goes a long way to try to minimize those complications later on in life.
Yeah, overall, just better quality of life, but you're right, before things become a big problem that may require a lot of help to intervene, you can nip it in the bud.
Yeah. I mean, one thing that I actually, we realized this year when we were looking at some of the stats is 40% of recently delivered women who've had babies actually neglect to go to their postpartum visit with their OBGYN. And that's really dismaying when you look at the state of maternal morbidity and mortality in the United States. A lot of the maternal deaths are actually preventable if women are getting the appropriate care.
Yeah. So why do we think women skip those visits? I think that's important to talk about. They're not just doing it because they're forgetting, typically.
Right.
And so there's 31% more likely to skip those healthcare screenings, well people visits because of cost.
Right.
That, I think, makes sense. Not everyone has coverage, and even when you do, there's out-of-pocket costs, and so more likely to skip.
And the cost of childcare too, especially if you have a newborn at home and you're like, how am I supposed to, take time off and then hire a babysitter or someone to care for my newborn while I run to my own doctor's visit? So that's another reason for skipping.
And when we're talking about menopause, you're maybe less likely to be having an infant or toddler at home, but we also know that symptoms of perimenopause start in mid-30s for a lot of people. So a lot of folks are going from maternity, obstetric care, right, having their children sort of right into that perimenopause phase.
Yeah.
And skipping those visits could mean, like you said, more significant health issues down the road.
Absolutely.
Yeah. 21% of women decided not to see a doctor, again, because the cost was too high, and that was an increase from the same survey in 2015. Women spend more out of pocket on their health care, and they're twice as likely as men to report skipping care due to the long wait for a visit, like at the doctor's office, or because of a transportation issue. And that's probably going back to women are often primarily caregivers, and so they have many responsibilities professionally in their families, and taking care of their health can also feel like a burden.
Right, so that's the beauty of actually being able to connect with somebody who has the right qualifications, the skill sets, the experience on a virtual platform, especially a virtual platform that works well. And so with our menopause providers, it's great. You schedule yourself for a 10:30 a.m. appointment. They show up at 10:30 a.m. You're back at your desk. You're back with your household duties at 11. And so there's less downtime or lost time that's not productive.
Yeah,
right?
I think telehealth has really shifted that ability for people to access quality care, both in healthcare deserts, but also, like you're saying, when they have other responsibilities.
Absolutely, but this is also why it's so important, and it's so exciting that more and more employers are mindful of this and trying to offer these solutions to their employees. I also think it's great. I was thinking of an idea that it would be great to actually have employers provide a certain number of days each year where women, well, anyone who needed healthcare, like would actually have just days, not just personal days, where they could say, all right, this is the day where I'm going to get my pap smear, my mammogram, my DEXA scan, my primary care visit out of the way so I can stay healthy long term.
Yeah, I think in many states, I know in New York, I live in New York, so I don't know if this is true nationally, but you can use sick days for things like doctor's visits, right? You don't have to be actively sick. You can use them for your self-care. Yeah. And so as Dr. Choi alluded to, employers are a big part of this sort of reducing barriers, right? And so if you work at a place where you don't have coverage for things like menopause care or other healthcare needs, talking to your HR is another good way to help start those conversations. Maybe your HR team doesn't understand what people are dealing with day to day, and so talking about adding coverage for things like fertility, menopause care, pregnancy, postpartum, et cetera.
Yeah, so oftentimes it's not that they don't care, they don't realize until you actually, until enough employees go to them and say, this is a really important need for us. And then they start exploring potential benefits to help serve their employee population.
Yeah.
And so Progyny site has toolkits, talk to your employer. And for menopause also, I mentioned menopause.org actually has toolkits for how to talk to your employer to try to get these much needed benefits in place for you.
Yeah, Progyny.com has really good toolkits, like you were saying. I think it's called Progyny.com/talk-to-HR. We'll link it. I just got the thumbs up. That's the right URL.
You're a little scary with your memory.
I
right?
really am.
Yeah.
I really am. It's because I'm being treated for perimenopause. So moving on to the next topic. In 2024, women's health continued to be to gain traction in popular culture, which I think is great. I think it's adding to the conversations that we're talking about. The conversations sort of in pop culture were around breaking taboos, around creating a sense of community, which we've talked about before, and then normalizing conversations around healthcare, which I think is the beginning of advocacy and the beginning of asking for help. So I think that's wonderful. So a few 2024 films highlighting journeys in women's health. So the first one is one of my favorites. I don't know if you've seen this yet. We talk a lot about what we binge on Netflix, but have you seen Joy on Netflix?
Not yet, although I did hear that it's fantastic.
It's really good.
It's the origin story of IVF. And also it features one of our providers.
Yes.
Right?
Yeah.
Very exciting.
Yeah. So Joy on Netflix, like Dr. Choi mentioned, is about sort of the infancy of IVF and sort of the first IVF cases. And it's really a fascinating discussion and a fascinating movie. The M Factor, I haven't seen this one, Shredding the Silence on Menopause.
I thought it was really educational and informative, and it's a short watch, so it's definitely worth a sit down and a watch.
And this is a documentary that addresses marginalized or ignored health crisis faced by millions of women as they go through menopause. I'll put it on my list. Scrambled.
Hilarious.
I have seen this one.
I almost
so good.
peed myself.
It's a good thing you manage your pelvic floor.
I know.
A film released this year explored the journey of empowerment of egg freezing. It's very good. If you're considering egg freezing or have done it or just curious, it's a good watch.
Or
it's
if you just
funny.
want a good laugh, it's quite funny.
Yeah. Mallory Wegman's documentary Watershed, I haven't seen this, was about...
Very moving, and she is one of my new heroes.
Is she?
Yeah.
Oh, I'll have to watch this one. Her postponed participation in the Tokyo Paralympics as she prioritized her journey with infertility.
She's a pretty remarkable individual, and she actually just won one of like her 5th or 6th or 7th gold in Paris's Paralympics earlier this summer. And it talks about her and her husband's infertility journey and their struggles as they, unfortunately with a happy ending, ended up with a beautiful young daughter. But yeah, it's also really worth a watch, very moving.
I love that all of these things are being talked about. Their representation in media and popular culture, I think, is really important because it does help to normalize.
I think for some people to realize there's nothing shameful about this. It's worth discussing. It's worth addressing right away versus hunkering down in a corner thinking that you're all alone.
Yeah, because you're not.
Yeah.
So moving to legislation.
Yeah.
So it's been an interesting year. And legislation specifically around IVF, so fertility. Key moments included a lot of folks fighting for coverage, you included.
Yep.
The legislative landscape surrounding fertility treatments in 2024 highlighted persistent challenges and small wins for reproductive health, which confirmed the continued need for education and advocacy.
Yeah.
One that I loved watching advocate, a person I loved watching advocate, I can't talk all of a sudden, was Senator Tammy Duckworth.
Yeah.
You were on a panel with her earlier this year, I
She's
think.
really impressive.
Yeah. And she has been really diligent on speaking out about her own fertility journey. She's a veteran, and she's been working to expand IVF access, especially for her colleagues, I guess, in the military.
For the military, for the vets.
Yeah.
Really important, and she's been tireless in trying to advocate for universal infertility coverage, but particularly highlighting the needs of military vets for those who are actually serving our country. So to me, it's a no-brainer. Why wouldn't you want to offer coverage? And so she's been, again, pushing for this continuously along with some of her more active colleagues, alongside organizations like Resolve and ASRM, lobbying for infertility coverage because, as we know, infertility is a medical condition that affects many people, 1 in 5 reproductive age women, men to a large degree as well, members of the LGBTQ plus community as well. And it's not just a right. This is a basic need that needs to be serviced and treated appropriately.
Yeah, I think past conversations have referred to it as though it's a choice, and it's really not. It's a medical condition.
Yeah,
and
some
should
people
be
seem to
treated.
think it's like a nice to have, right?
Yeah.
It's nice.
So there were also some state restrictions that happened this year. States like Alabama and Missouri imposed restrictions limiting the protection of IVF treatments. In Alabama, there was a ruling that sort of for a few weeks-ish paused treatment in that state. There was a ruling that sort of allowed treatments to begin again. It's something that we watch pretty closely to make sure that across the U.S. people continue to have access, and organizations like Resolve are also working to stop that sort of lack of access or those barriers from being created.
Absolutely, and actually there are more states now, which is hopeful news, that are working to protect reproductive rights, including fertility and family building.
Yep, agreed. So some good news on the legislative front. The Right to IVF Act of 2024 was looking to protect and expand nationwide access to fertility treatment, including in vitro fertilization. It did fail ultimately, but went through a few rounds of votes, and there's hopefully...
And I think it was pretty close, actually, the voting, so I'm hoping that it's going to pass at some point. I think it should be nonpartisan, and I think most people recognize this because, again, it is a medical condition, but, fingers crossed for the future.
Yep. And then you alluded to some state mandates that were rolled out this year, a lot of really great ones. Some focused specifically on fertility preservation for cancer patients, but others were just sort of having access to coverage in California. It's not, the coverage isn't live yet, but a bill was approved to provide access to folks in California. That's a state mandate. It'll require certain fully insured, there's a little distinction with what kind of insurance you have, but certain fully insured health policies will cover both the diagnosis and treatment for fertility.
That's really fantastic. And again, a shout out to the Chick Mission crew in terms of pushing through legislation that passed in several states this year to cover fertility preservation for cancer survivors. A really important move.
Yep, agreed. And in Illinois, likewise, there was some referendums on the access to care and how it's important. Illinois already had a state mandate, but it sort of continued that, which is great. Yeah. So there's some small barriers being placed in, but most of the time they're resolved relatively quickly. But on the other side, states are increasingly expanding access to care and working with organizations like the Chick Mission, Resolve, and others.
Right, but again, this doesn't mean that we can be sort of resting on our laurels and being complacent. We have to continuously create noise and make sure our legislators or politicians understand why this is such a vital need for a big chunk of our population. Like basically, if you believe in family building, you need to support this.
Yep, and that's important at the legislative side, but you can also, we said this a little bit already, but you can also do this at your own level with your HR team, with your employer. There's ability to make change there too. Okay, So in conclusion, we covered a lot. We went on a wild ride today.
It was a wild and crazy 2024 summary. One thing we forgot to mention, but again, we left the best for last, is back to the whole excitement around women's health needs, fertility and family building needs coming to the forefront, whether it's in a form of a movie or podcast or documentary or legislation that's being passed. Don't forget about your patient care advocate, right? So if you feel like, I don't want to share this with everybody, but I have some concerns or questions and I just need to talk to somebody or I need some guidance, if you are a Progyny member, you are in luck because Lissa's team is here to help you. Guide you along this very convoluted path sometimes. Yep,
you have access to a whole host of experts, nurses, doulas, embryologists who can help answer questions and sort of create transparency because as much as it is in the media and pop culture, it's still confusing. It's still some stigma around it. Not everyone feels comfortable talking to everyone, and that's okay. And so with Progyny, you have a person, and that's really good. Yeah, good call out.
Yeah.
As always, I love DocTalking with you.
I love DocTalking with you, Dr. Lissa Klein.
Thank you so much for joining. Please continue to let us know what topics are important to you. We love hearing from you, and we love DocTalking. So anything that's relevant to you or questions you have, let us know. I think you leave a comment maybe on the video, and then we'll
type it away.
Yeah, type it away.
And we'll see you in 2025.
Yes, we'll see you in 2025. We can't wait.